G'day, I'd just like to show you some of the instruments that we're going to use in conjunction with the Piranha morcellator. This is the cystoscopy system and laser resectoscope system and the morcellating telescope system. So we just have a look at the table here. Initially the physician will want to do a quick cystoscopic check. Here we have a 21 French cystoscope sheath, and we also have a choice of either a long bridge with the standard Alboran deflector. You can see the tip just moving upwards and downwards. If you choose to use a long bridge, usually just a quick cystoscopic check, we'll go in with the short bridge there. You'll see the typical Wolf mechanism here of a notch and a nose. So just make sure you've got that little notch and nose lining up, and release the slide mechanism. Give it a little tug just to make sure it's in position. To release the bridge, just slide that across. Typically what will happen is the physician may put his finger on this side and wonder why he can't slide. So just get your finger out of the way, slide, easy. So on this end we've got our 4mm standard urological telescope, 30 degree. It will just slide in and through and lock it off like that. Light post on there, either instrument access ports there, but usually it's just a quick cystoscopic check. So then we'll move on to our laser resectoscope. So after we're happy that everything is normal, we then want to insert a resectoscope. So we've got an outer sheath which is 26 French. There is a 24 French alternative, and an inner sheath which is 24. They simply click together like that. We then have a choice of obturators to insert. We've either got a standard obturator, again, classic Wolf notch and nose system, pushes in. This time to release, just push forward on the black, obturator comes out. If we want to go in under vision, we have a visualizing obturator, denoted by the little hole in the end. We insert that in. Again, we've got a notch and a nose, push, and then the telescope will go in, and we can insert this into the patient under direct vision as well. If the physician wants to use, or if the patient has a particularly difficult prostate and access is quite tough, we use what we call a Timberlake or a deflecting obturator. And that is inserted in. Again, we've got a notch and a nose system. And to deflect it, we press at the end. The physician knows all this, but just so as you're aware, and you can see the tip going up. That allows us to insert into the urethra, and as we deflect it, it just pops up into the bladder. We now then want to use our laser resectoscope. And this is this little item here. On the end, we have our laser insertion point. This is a telescope point here. We've got a little fairly unique clamp locking mechanism. These parts are both reusable, so don't throw them away at the end of the procedure. The little seal just carefully pops on there, and then we screw that on to the end here. Put it on it finger tight and then back it off, because what we're going to do is to put the laser fibre in here and then clamp it down against the laser fibre. That holds the laser fibre in position. We then want to insert a laser fibre guide tube. Now this is fairly unique to Richard Wolf in that we have an option of inserting two different sizes, depending on the caliber of the laser fibre we're about to use. Two common sizes are 800 micron and 550 micron. That's placed into the bottom hole. You'll see it comes through here, and it'll pick up that alignment hole in there, and just push, and you heard a little click there. That's the laser fibre locked into position, but being careful, I always like to give it a little tug to make sure it doesn't come out. If you do want to release it, press this red button here, and that releases. So push it back in and click. We then take our telescope, just make sure that's at the 12 o'clock position. That's the telescope locking mechanism. Carefully slide that through and make sure you pick up the little guidance points here with the telescope as we're inserting all the way along. Okay, and then lock off the telescope here. We've already inserted this into the patient, or the doctor has at least. And again, we've got this little locking nose mechanism. Just pick that up, click, That's in position. Now we've got two irrigation ports on here. There's one inflow, denoted by the arrow, irrigation in and irrigation out. Just make sure that they are connected on an in and out mode, because it does affect the visualization properties inside the bladder. Okay, so at the end of the procedure, the doctors enucleated all of the prostate, pushed it into the bladder. We now have to get the tissue out of the bladder. We're going to convert this into using our morcellating telescope. Some people call it an offset nephroscope. Ours is fairly different in that we have a wide open port here. This is where the blade's going to come through, and it gives us a maximum amount of fluid flow and access to the bladder. On the back of this, we have a little sealing cap which seals around the blade we're about to insert. This is again reusable. Just placed carefully in the back. There's a little cap, goes on the other side. And we're going to attach this cap. I always like to rotate it the wrong way and then back the other way. Okay, that's that done. So we go back to the resectoscope. To remove the working element, pull back on the yellow. So pull this back. So this is going to be left inside the patient. We don't need the rest of it just now. We're now then going to insert the Morse scope in to the patient. I've got it caught in my sleeve. Let me just push that in. Put our camera on here. Light source connected onto there. And we're now going to insert our blade, which goes directly through here. And you'll see it come out of the tip. And we'll be ready to operate. Now, one of the other tricky things that quite often scrub nurses will have a little bit of initial difficulty with is inserting the blade into the handpiece. And that's primarily because we have to have an airtight seal around here. Inside there, you might just be able to see a little blue O-ring. But believe me, it is in there, about 1 centimetre down. So what we're going to do is to insert our blade into, so first of all, pull back the collar. I always make that mistake too. Pull back that collar, and again, we've got this little notch and nose system. And with a little bit of force, just push down on the blade. Sometimes you might need to coax the outer ring up. Give it a little tug, and it's in position. So that then is inserted in. The surgeon is ready to start morcellating. That's all we need to know. Thank you.